For Levator, sure we start for Levator. Yeah, let's face this way for a few different ones. Origin of Levator Scap is
C1 and C4 transverse process.
right. It's what this is another one, swaps just based on motion all the time. For the most part, Levator scapula, Levator scap, it tells what it's mostly going to do, lift the scapula. So origin is C1 to C4 transverse. It attaches to the insertion, which is where?
Superior
Medial border.
angle.
Superior angle, right. So we find it superior angle right here. I'm telling you guys, that's a huge trigger on so many people. You go up to anybody and poke them in there, they'll just melt away. Really? So now let's stretch this out. What do I have to do to lengthen the distance between point A and B? Let's lengthen it.
Contralateral rotation.
Boom. Alright, what else?
Lateral then contralateral.
Flexion. What's that? Flexion? Possibly a little bit. I won't argue with that. What's the other one?
Scapular depression.
Thank you. Scapular depression. Actually, you know what? I'm going to contact, with me, I contact right at that origin and break it down. How's that right there? Okay. You guys, tissue, I'm getting more vague with the tissue work side of things because we've gone over it. It's the same thing over and over again. If you know where it starts, where it ends, you know your contact, just follow it. But with this one right here, I'm going to try to put a little bit of tension on that. Right here. This is a tough one to get because I'm working at a funky angle. This angle's tough for me to work at, always. There's no real easy way to do this one. But I find superior border. And with me, I'll use a thumb. I'll hold the scap down. I change it up, but I'm right on it there. Right, I want to see on you guys in the test that you do a glide all the way up to the transverse. All the way up there. Most of the time I see problems happen at the origin of C4. So superior medial angle, we can work it. I don't care, you can do a pisiform here and work up. You can do a thumb. It's pretty open here. The area of space is pretty open. The only area that's not open is the nook, right where it attaches. It's a little tough to get there. I'll sometimes do friction right over that. Right there. Then work up. Okay, those are those three. Upper